We've gotten some updates since last night about Maple Leafs captain John Tavares after he was involved in that pretty scary collision during last night's playoff game. Welcome back, everybody. I'm Dr. Brian Sutterer, and this is your number one source for learning about the unique medical side of the world of sports. I want to share some thoughts on the updates we've gotten about Tavares' condition, and then also review some things from last night's initial video, because there's some additional things I really want to emphasize a little bit more, and then some other things to discuss. The first thing I want to stress here that I don't think I made as clear as I would have hoped in the initial video was the sequence when Tavares was down on the ice here. So the medical staff member gets out there, and initially, yes, in this position, your hope is that the athlete that you're worried about having a cervical spine injury stays down. In this case, that Tavares stays prone or on his stomach while you're stabilizing the spine. And then once the full team gets out there, you properly turn the patient onto their back, get them on the spine board, and then off to the hospital. So yes, everybody that was criticizing this, ideally, you want the athlete to stay down, whether they're on their back, whether they're on their side, their stomach, whatever. Stabilize the neck, stay down until you can properly turn them. But Tavares trying to get up here is not the fault of the medical staff member out there. It's so hard when you have an athlete down with a concussion who is just alert enough to have their senses of trying to get up. It's so hard to keep them down and safe on the ice or on the field. Number one priority here is stabilizing the neck. And so I guarantee you he's talking to him, calm down, it's okay, calm down, stay down. But Tavares is altered enough that he's trying to get up. If they actually would have sat on him and tried to physically force him down more, Tavares probably would have fought back even greater. And then you risk losing that stability and that control of the neck. And then they thrash around. And then if there is an injury there, it gets worse. So it's a really tough balance between making sure you stabilize the cervical spine, trying to keep the athlete down, but then sort of working with their mental state at the time to ultimately just keep them as safe as you can. Also, just to do this on slippery ice is so darn hard. So again, great job by the medical staff out here. Yes, ideally you want to keep the athlete down and immobile until you can properly turn them, roll them, move them onto a backboard. But you also can't fight the athlete, because if you fight the athlete, they could get a little bit more out of control. You could lose that stability. So imagine if all this, Tavares inadvertently swung at him and he lost that control of the neck and then falls down. That can result in a much worse injury. So stabilize the neck, try to keep them calm as best you can, but ultimately make sure you maintain that stability of the neck. Next, some people asked about the blood that we saw that almost looked like it could have been coming from his eye. No, the blood wasn't coming from the eyeball itself. That was just from when the knee came in. It basically came up, pushed underneath his visor, and scraped along the skin of his eyelid, causing him to bleed from the skin around the eye, not the eyeball itself. If you had a major open globe injury, like a ruptured eyeball or something, then yeah, maybe there could be some blood theoretically coming from the eye, but honestly, I don't know if I've ever seen that happen in sports. And so when we saw the blood here, it was just from the skin being cut because of the knee, the padding kind of coming up underneath the visor and then cutting above the eye that way. So then last night, one of the first updates I saw was that he was conscious, communicating well, was going to be in the hospital overnight, and that tests had come back clear. When we hear about tests like this from a hospital when a player's had a traumatic event, usually we're talking about imaging studies. We're talking about CT scans that look really well at the bone and just the gross appearance, major bleeding within the brain. MRIs that are going to look at more fine detail of the nervous system in particular and the ligaments and soft tissue structures of the neck. And then x-rays for, limbs. Clear just means those tests were negative, which in the medical sense is reassuring. It means no fractures, no big major bleeding in the brain, no big objective signs of trauma from the imaging studies. But those imaging studies don't tell us whether or not somebody's had a concussion unless it's so severe that they've had a more definite, severe traumatic brain injury with blood in the brain or fractured, depressed skull. We got this update from the Maple Leafs this morning saying he had been discharged from the hospital, thoroughly examined by the neurosurgical team, was kept for observation overnight, and now is back at home under the care of the team physicians, out indefinitely. So far, all this reporting has been very reassuring. It doesn't sound like they found any evidence of nerve damage to the spinal cord or impaired neurologic function with gross movement of the arms and legs. No big skull fractures, no eye injuries, no bleeding within the brain. So far, all very positive updates. But again, these tests don't diagnose a concussion. A concussion is a clinical diagnosis based on things like loss of consciousness, the symptoms the player is exhibiting, their more fine physical exam with the nervous system in terms of balance, coordination. You don't diagnose a concussion based on a CT scan. And that's important to know because a lot of times players go to the hospital when they've been knocked out or had a head injury, and we see a report that testing was negative and they were cleared. That doesn't mean they don't have a concussion. That just means that the imaging tests didn't show anything more severe like a bleed or a broken bone. But again, don't diagnose the concussion. So we can't say no concussion just from clear hospital testing. Pretty easy to see from how altered he was in the video that Tavares had a concussion here. So while there could certainly be some more mild injuries that they just haven't reported because of less severity, it seems like the big thing for Tavares' recovery is going to be concussion recovery. And as we know, for every player, that's very different in terms of how much it affects them. Depending on how far the Maple Leafs go in the playoffs, yeah, certainly if all we're dealing with here is a concussion, he could recover quickly enough to come back and play. But we have to realize there could be other small, minor things here that just aren't severe enough to make it into these reports that could limit his return, and just the concussion itself could result in a prolonged absence that he's not able to get back for the playoffs. So that's it for the video. Let me know below if you guys enjoy these more update style videos whenever we have new information kind of after those initial breakdown videos. I want to make sure I'm giving you guys the best educational content here, and so please let me know what you think. Thank you as always for watching, and I'll see you in the next video.